day of surgery, they need to fill out some forms. Those are absolutely necessary. The first one is again health questionnaire. They need to be writing that down again, and the reason is to make sure that there's nothing changed since the time of initial consultation, which sometimes can be months before they go for the operation. So we basically review that health questionnaire and make sure there's nothing changed. The second thing is that I usually come in the morning and re-examine them, and we'll go over the surgery again. I usually mark the abdomen and show them the incision area, and we usually ask them to wear the bikini that they usually wear, so we can hide the incision underneath of that. And then we discuss about the anesthesia, and then they have to sign the form, which is the consent for surgery and anesthesia, and that's again is a legal permission that they give me to perform the operation. They need to have pictures before and after the surgery or during the operation, so they will fill out a consent form for photography, and also they have a paperwork for advanced directive, and if they have advanced directive, means that they have someone to make decisions during the emergency. They will fill that out. The last thing they do is they fill out a current medication, and we go over that list of the medications again to make sure that they're not taking any sort of medicines that will cause trouble for surgery, and that way we will pick that up before we performing the operation. On the day of surgery, we also go over the type of anesthesia that we'll get. Majority of my patients that they have abdominoplasty or tummy tuck, they will get a general anesthesia, and majority of times I will add local anesthetic. Is called tumescent, which is the diluted lidocaine with epinephrine, which decrease the pain after the surgery and also decrease the bleeding during the surgery, and that will be given to the patients prior to the operation in the operating room. But majority of them, they go under general anesthesia. All of the patients, they require IV access, which the nurse or anesthesiologist will place prior to the surgery, and all of these patients, they are going to be outpatients, and they will go home that day after the surgery. After the operation, which usually takes between 1.5 to 3 to 4 hours, depending on the type of abdominoplasty or whether we combine this with liposuction, then they will come to the recovery room, and they usually stay in the recovery room around 1 to 3 hours, again depending on the extent of abdominoplasty. They will usually have abdominal pain because we approximating the muscle, and tighten the muscle together, and we bring and pull the skin, and we do a lot of dissection during the surgery. So the abdominoplasty operation is painful, and after the surgery they will get appropriate pain medicines. They might have some nausea and grogginess because of the anesthesia medicine, which they will be even given appropriate medications that are anti-nausea as well after the surgery. They will have some sore throat because when they go under anesthesia, they get a tube inside the mouth so they can connect it to the ventilator, and they get oxygen through that tube, and that tube is a firm and hard plastic, and sometimes it causes a little bit of sore throat for the patients after the surgery, and they will also may have a little difficulty urinating initially after the surgery, but it will get better eventually. The sore throat normally go away within 24 to 48 hours, and difficulty urinating again disappears after 24 hours. And patients usually require pain medication after the surgery, and they will go home with a prescription for pain medicine and also some antibiotics, because majority of patients with abdominoplasty, they will have a drain place, and I usually send them with antibiotics until the drain is out. All of them, they get abdominal binder or compression garment is the one that we put on right after the surgery that really helps for decreasing the swelling and also decreasing the pain after the operation. They all need someone to take them home, a ride to home, and they cannot drive obviously after the surgery.